Alright, so this is like take 3 for this video. This is day 5 of Heart Awareness Month, and the topic for day 5 is surgeries and catheterizations. So Freya did have open heart repair. Prior to having open heart repair, she did go to the cath lab. The cath lab refers to a catheterization lab. And there can be some patients or people are able to have some of their heart repairs done just in the cath lab. But most often it's used to assess pressures of the heart, and it's often used to determine eligibility for open heart surgery, like if that patient is a good candidate or not, how safe it is to repair their heart based on the pressures in their heart, all of that. So Freya had hers done about a week before her open heart surgery. There was concerns that she might have pulmonary hypertension, which is, or like higher pulmonary vascular resistance, which is a big reason that a lot of kids anyways that I've seen end up being trached, is due to pulmonary hypertension. It can be very useful in that. That is not why Freya got trached. But anyhow, her cath lab showed that she actually was a good candidate for open heart surgery. Her pulmonary vascular resistance was not too high at that point. It was like borderline, but it wasn't considered pulmonary hypertension yet, and so therefore she was like at a good spot to have her open heart surgery. And when they do the cath lab, they generally go through, it's like a little catheter. It's like a hollow little tube with like a needle on it. They go in through the femoral artery generally, and then they go up and into the heart so that they're able to monitor pressures, and all of that. So they do sedate you, or they give you general anesthesia, and for Freya anyhow, they gave her a paralytic as well. And that was when she came back from the cath lab. That was the first time I'd ever seen, I think, anyone probably on a paralytic. And that was really hard for me, honestly. I think that was one of the harder things. That's one of the harder things to watch her go through, is I really dislike seeing her paralyzed. I'm sure most people agree with, that in general, probably don't prefer to see people on paralytics. It's kind of, it's kind of sketchy. Anyhow, so, and those wore off, fairly quickly, but that was great news. We found out, like I said, through the cath lab, that she was in fact a good candidate for open heart surgery. And that was, one of the things that Boston wasn't sure of and had wanted to check before they would agree to do her open heart surgery. So that was a huge step for us to get that done and find out that she was still a good candidate. So then originally Freya was supposed to have her surgery on a Tuesday. She ended up having it on Thursday, August 29th, 2019. But she was originally supposed to have had it. Okay, so as I was saying, she had her heart surgery August 29th, 2019. That was a Thursday. She originally was supposed to have it on a Tuesday. The Tuesday that I originally thought she was supposed to have it on, we woke up, we prepped her for it. The nurses got her all prepped and stuff, and we got her all swaddled, we got her all ready. I sat down in the chair and I was getting ready to hold her so that we could have some cuddle time before they took her back. I had spent, like I said, I'd been up since like 4 o'clock that morning prepping her, because she was first case. They're supposed to get her at like 7 o'clock in the morning. And, honestly, you never know if somebody's going to come out of surgery, and especially open heart surgery. So I was doing all I could to prepare myself for that, just praying over her, memorizing every feature of her body. And then I sat down and I went to hold her. The nurses had brought her to me. At that time, she was still intubated, so she had an endotracheal tube which went down her trachea rather than her actual tracheostomy tube that she has now. So when they set her in my arms, she instantly turned gray, and her sats started alarming. And when I looked up, it was at 12%. So they swiftly took her from my arms, put her back in her little bassinet thing, suctioned her, everything, got her all settled, and she was fine. What they think happened was that she may have had a mucus plug, which is just like really thick secretions that came up into her endotracheal tube and may have plugged it, and that's why she dropped so fast, and with the movement and everything, it must have lodged it into her tube, and then she wasn't able to breathe. And so after they suctioned her, she was fine. I was petrified to hold her at that point. I wanted to so badly, but I was scared because I thought she was going to open heart surgery, and I wasn't sure if that's what caused the event, and she was really fragile at that time, and I didn't want to hold her and cause her pain or cause another event or something. So I just spent the rest of the time holding her hand, stroking her head, like I said, getting ready to send her off for open heart surgery. She was only a little over 2 months old. So waited and waited and waited, and when teams came around, it was about 9 o'clock, so they should have already taken her. They hadn't. They came by to tell me that they wanted to do a 4D ultrasound of her aortic valve because they wanted more details about her anatomy as far as her valve went. When they did the 4D ultrasound, they found out that she didn't have a bicuspid valve, which is good because you're supposed to have 3 leaflets in your aortic valve. They had originally thought she had 2 just because of how dysplastic it looked on her echoes, so they thought it might have been bicuspid. She did have 3 leaflets they found on the 4D ultrasound. She also had a tear in one of them, so she almost had like a quadricuspid valve, which isn't great either. So they had postponed it because they wanted to do the 4D ultrasound to get more detailed information, as well as they wanted to do another bronchoscopy, even though they had done one, earlier in the week and had discovered that she had bronchomalacia, which in part is due to how small she was when she was born. She was born at 38 weeks and 1 day, but essentially she was about 6 weeks delayed in growth, so she was more like a 32-weeker. And I had steroid shots actually when I was 32 weeks along, because Freya had given us a scare at an NSD and had dropped her heart rate significantly. So I had ended up on the birthing pavilion, and they had me sign for a cesarean and prepped me and all of that because they weren't certain if she'd be getting one, so they had also given me a steroid shot. Thankfully, after being admitted, I had some IV fluids, some sugar in the IV fluids. They had given me oxygen at first, and all of those things did bring her heart rate up, and then she was able to maintain her heart rate through the rest of that day, overnight into the next day. And so thankfully she was not a cesarean. She was not born at 32 weeks, but she had given us a scare. So I had received both the doses of the steroid shot for her lungs. However, like I said, when she was born about 6 weeks later or so, at 38 weeks and 1 day, she was still very small. So I think her lungs were just very underdeveloped, which plays into why she has bronchomalacia and why she has the trach. She also, I think I've mentioned before, had gone about 2 to 3 weeks where she had severe edema and was holding there was a lot of fluid surrounding her heart, and that excess fluid was also pressing on her lungs. Unfortunately, the cardiologist at Dartmouth did not acknowledge this, did not treat her during that time, and therefore that fluid just sat on her lungs, which obviously weakened them as they were already weak. Thankfully, over a year and a half later, her lungs are starting to get stronger. But anyhow, I got off base. So they had postponed her heart surgery because they wanted to do the bronchoscopy for, just to make sure they knew her lung status and everything, and as well as look more at her valve to get better information before they went in there to repair. That day, the little girl the baby who ended up taking Freya's time slot happened to be one of my childhood friend's daughters, who was also there at the same time, and we actually ended up, I ran into her that day, and they hadn't planned for her repair to be that day, so she was a bit shaken up, but I found comfort in that I knew the baby that took that spot and that she was getting her repair. I was able to hug her mom and comfort her and tell her they had the best, she had the best surgeon, she was going to do great, and she did. She's doing amazing. So I just want to share that because I thought that was a cool coincidence, We're both from a small town in Vermont, and we both happened to have babies around the same time that had heart defects that needed to be repaired. And we both ended up at Boston Children's Hospital. And in fact, like I said, Freya's surgery was on Thursday. This little girl was on Tuesday. We actually ended up in the triage bay together. She was on our left side, and there was another little baby on our right. Freya was right in the middle. But we got moved there the night before surgery, so we got moved there Wednesday night. And did the same thing, got up really, really early to help the nurse prepare her. Her nurse's name that day was Patricia. She was Irish. She was lovely, one of our favorites. So she helped me get Freya all cleaned and prepared, and I did get to hold her that day and give her lots of lovin's. Same thing, prayed over her, memorized every feature because we truly didn't know if she'd be coming back out or not. And honestly, at my home hospital, I had been told by that same cardiologist over and over, he tried to convince us not to do repair because he told me that she wouldn't make it out alive. And so it was really scary to send her back. But I did. I walked back until as far as I was able to go, gave her a kiss, went and checked in with the nurse liaison, gave her my number so that she could keep me updated. Freya's surgery, gosh, I want to say it lasted from about 8 a.m. until about 4 or 5 p.m. It was a long procedure. She had her large VSD patched and closed. She had her PDA ligated. She had her PFO or ASD, depending on which cardiologist note you read. She had that closed as well. And then she had her aortic valve repaired. They did a palliative repair. They were able to reduce the regurgitation from severe to mild to moderate. And I got the call. I met with Dr. Canones, one of her surgeons. It was Dr. Canones and Dr. Baird. I met with him after, and he told me, that she was doing well. She was all done. She was off bypass and everything. The only thing was her chest was still open. Her heart and I guess everything. When you do open heart surgery, there is the risk of having to leave the chest open sometimes, because if you close it too soon, it can hinder the heart's function. It won't be able to beat. Like their blood pressure will just plummet, and their heart can't beat due to the pressure and the swelling and everything. So that was the case with Freya. It was less than 24 hours that she was open. I want to say about 18 to 20 hours. They closed her chest in her room. I do have pictures of what was open and then after closing as well, which I will post both. She also, after open heart surgery, was on morphine, epinephrine, rock, which is, again, the paralytic. And the first 24 to 48 hours are really rough. There's a lot that goes on. There's lots of adjusting the medications to make sure that you keep their their blood pressure at the right spot, making sure that you have them sedated enough, still enough, comfortable enough. So the first 24 to 48 hours are pretty touch and go and can be kind of rocky. At that time, I was staying bedside in her room. I stayed bedside in her room pretty much the whole time we were in Boston. I did come home periodically, so I was there for all of that chaos. By day 3, they started, weaning meds, being able to pull chest tubes and things like that. Freya did have like a chylus thorax. I want to say she had or chylus effusion. She had it's a byproduct. It's like a fat that's produced by the lymphatic system, and often after heart surgery, I think some other surgeries too, sometimes your body just can't handle those fats, and that's your body's way of letting you know that. So we had to switch her formula for a period of time to help resolve that. But otherwise, she did pretty well post-op and recovering. 3 weeks after her open heart surgery is when she had her tracheostomy, which honestly, that was a longer recovery period and had more complications. But yeah, so that's it for her heart cath and her open heart surgery. And yeah, I will, like I said, post some pictures, see if I can find some doctor's notes about the surgery and whatnot to post. If you guys have any other questions, that you want answered in general anytime, you guys can always PM me on her account or on mine. I'm always happy to answer questions.